And we've been answering your questions about the Affordable Care Act all week. Tonight, we are taking a look at how the new health care law works with Medicare and Medicaid. Max Rickman is president and CEO of the National Committee to Preserve Social Security and Medicare. He is joining us. There he is from Washington, D.C., using Skype tonight. Do you hear me? I guess you can't see me, but you hear me okay, huh?
Oh, I hear you and I see you.
Oh, well, great. Wonderful. Okay, so let's get it started and with the basic question here for people who are using Medicare and Medicaid. How does the Affordable Care Act apply to them? What happens to them?
Well, there's no change to anybody who's a Medicare beneficiary in terms of what they pay and premiums, and they don't have to do anything. Basically, there's no need to take any initiative, any action. It's very important that Medicare beneficiaries understand and appreciate the additional benefits that the Affordable Care Act provides for them. Many preventative care services, such as mammograms, colonoscopies, diabetes screenings, for the first time ever under the Affordable Care Act, a Medicare beneficiary is able to avail himself or herself of these services with no out-of-pocket costs whatsoever.
We're going to talk a little bit more about those benefits, but before we do that, I want you to give me a little bit of a history lesson, because you are really very influential in preserving, as you said, Social Security, Medicare, Medicaid, so you know a lot about this stuff. We've seen some pushback when it comes to the Affordable Care Act, and I want you to explain to folks what it was like when these other programs rolled out or kicked off, like Social Security, for example, like Medicare, if you can talk about that.
Well, there were bumps in the road. I was not personally involved in those rollouts, but my understanding and work on Capitol Hill for many years, staff director of the Senate Aging Committee, the historical perspective shows that there was a lot of opposition, Medicare was decades in the making because there was such intense opposition by special interests, particularly the American Medical Association. It took a long time to gain the confidence of large numbers of seniors and the American people, and the result was that Congress passed the Medicare program. But these are dynamic programs. They evolve over time. They're not the Social Security in terms of the way it covers individuals. The benefits that are provided has evolved, as has the Medicare program. We just a few years ago, 2003, added a prescription drug benefit to the Congress did, and was signed into law by President Bush. So these are dynamic programs. It takes a while for the people that are covered to appreciate them and to use them and understand them. And I venture to say the same thing will be true of the Affordable Care Act. In a few years, it will become as accepted a part as a part of our way of life as Social Security, as Medicare, and I think it will stand the test of time as the other programs have.
Thank you so much for your insight today as we continue to talk about the Affordable Care Act here on the WGN News at 5. We really appreciate it.